Dr. Wilson, welcome to the show, my man.
Thanks for having me, Dr. Jason.
Man, so take me through, first off, what drink did you choose for the evening?
Well, I don't always drink water, but when I do, I drink Evian. Stay thirsty, my friend.
Oh, that's fantastic. Man, what I went with tonight is a pretty funny story. We took a couple friends out to Rosie's. I don't know if you've been to Rosie's yet here in Hendersonville, but really nice restaurant and had a really great time. Well, we got a bottle of wine, asked for what's one of their more introductory type wines, because I'm more of a whiskey guy. I'm not much of a wine guy. And they said that this blend was just the best. So they broke out the blend and we saw the price tag afterwards and was like, oh my gosh. So anyway, we went to Bluegrass and asked them, how can we get this wine? Is it way cheaper? Maybe if you're not at a restaurant or something like that. And they said, you know what my favorite blend is, and our best one is this one that's 14 hand hot to trot. And I was like, okay. And I said, how much is it? And they said $9. I was like, there's no way it's going to be any good. Got it. And it's incredible. I'm like, you've got to be kidding me right now. This just happened. So it's the only red blend I'll have, but it's pretty dadgum good. So that's awesome. One of the biggest reasons we bring a drink into this is to be able to do a cheers to charity. And I'd love for you to introduce the charity that you're sponsoring tonight.
Yeah. So I'm sponsoring Nashville Rescue Mission. It's a charity that's dear to my heart. It's somewhere that I've served at through my church, and they do a really great. They have a really great program there for women who need to get off the streets, and they take them in, and they help them and their kids in that respect. But it's a really good organization.
That's awesome, man. Thank you so much. We now want to talk about our sponsor this evening, which is Interventional Pain Center. I want to give a brief shout out that is really important to me about this company. And Dr. Brad Wilson, this is the clinic that you practice at, and something that we at Active Spine and Joint Center have been so impressed with for so many times with countless number of patients is the ones that are very extremely challenging from a rehab exercise and hands-on care. Sometimes there's, we really hope that we see every patient come to the clinic very early on, but sometimes the reality of medicine in 2020 is that we see cases that are very reactionary. And when we see those, sometimes they're later into a process and really need some help for us to be able to get them out of that. And I just can't tell you the number of times that we've had such great care from your office and the reports and how we've been able to get them over a hump that we just couldn't get them up over otherwise. So big shout out to our sponsors. And they're also going to sponsor and match the donation that you're personally making tonight to your charity of choice. And so I really, really thank you for that.
I appreciate you saying that, Dr. Jason, and it's been a pleasure collaborating with you as well, sending patients to you. I've had a lot of patients who have come back and said really good things, and you've been able to help them in ways that I can't. And so I think the way you run your practice and the way I run my practice, I think we synergistically work well together.
Brother, I agree. And I think we could talk about that forever. And I think we're going to touch on a lot of those tenets here later because there's so much that we want people to understand about care. And I think one of the themes that I really want to get to is just how important it is if you could be hearing this message way ahead of time, or maybe you have a loved one that's beginning to have some persistent pain. The things and the options that are there for them, if you get out ahead of it early, a lot of the things that it can prevent and keep away. I think that's going to be a really important discussion. I did want to ask you, though, how have you been doing without sports around lately?
Man, it's been rough because I was so used to watching sports every night. I had the NBA league pass, and I'd watch games every night, and just can't do that anymore. So now I've turned to the boring stocks. That's what I'm into now. Looking at the stock market, stuff that I didn't really look at before, but it's the only thing really on. The news is too depressing for me. So.
Yeah, it is wild, the connection between looking at the stock market and looking at, say, like fantasy football or fantasy basketball. It is wild how a lot of the statistics, they come back to there's different roles, different players, but there are a lot of similarities there. I'm a huge NBA fan, just like you are as well, and we've connected on that very well. And did you look into any of those news breaks about the potential play-in for the last spot coming up or anything like that? Have you heard about any of that?
So I've heard about it. I don't know all the specifics, but I've heard there's going to be like 22 games or 22 teams or something like that. It's going to be a very limited season. Maybe you can tell me more about it, because I've just heard it secondhand. I haven't had time to really look it up.
I think the hardest part is, regardless, it's going to be such a different NBA than what we're used to. Yeah. But at the same time, as soon as I saw that tweet come across, I got the itch. I was like, I'm ready. I need to see Steph hitting a 30-footer. It's killing me. I need the NBA back.
I got so excited when I heard that they were going to at least play some basketball. I'm like, well, I'll take it. I'll take what we can get.
Yeah. The other thing that I think the viewers need to know, it's pretty important here, is that we both enjoy that fantasy football, that fantasy basketball type thing. And sometimes it makes sense to go into a friendly wager with one another.
And sometimes it can be a costly wager.
And sometimes it can be. And the other thing is, when two individuals are very passionate about their stance on a given thing, sometimes it just makes sense to just put something on the line. And, we have done that a couple times, and I've lost a little bit, but I will say that there was a victory that did occur that I would love for you to narrate to everyone exactly what happened. I can't remember. It had something to do with the Titans. And again, we love our Titans and we want them to do well, but it was just a little ambitious. And while you moonlight and just use a very great voice to explain this, I'll just give our viewers the video on repeat while you explain exactly what went down that day.
Yeah, I admittedly voted with my heart and not my brain so much in that game. Kansas City was favored to win, but the Titans, they were on a roll. That run game, they were looking really good, and so I thought they were going to win. I bet on them. We went with the pie in the face.
The pie in the face. The beautiful part that everybody's getting to watch right now, I put a couple in there that are in slow-mo. Really appreciate those. They're real good. The other great part about this is that's really funny in the video. That was not a typical cream pie. This was a pie that we prepped 4 hours earlier thinking we were doing something great. And you know what happened? It melted. And it was in the fridge. And it got to the coldest, stickiest soup that you could pretty much ask for. That was something special. That was a great day.
It was cold and gooey, and you certainly let me have it. That's for sure. There was no easing into that one. But
I know, it was so funny.
I deserved it. I took my punishment like a man.
God, I will take that bet every time. I love when we do those bets. We should do those with larger disparities of what Vegas thinks and your position. I really enjoyed that. I would love to do that again. I think it'd be great.
Yeah.
To think about, when I went through my sports chiropractic physician training, one of the things that one of the instructors that always stuck with me that they'd said, and since we're talking about sports, this jumped in my mind. One of the time they said is that the athlete of today, the injured athlete of today, if you don't, in the sports medicine side, get to intervene with them right away and get to do good treatment right away, they're the chronic pain patient of tomorrow. And that always stuck with me, and I don't know how much validity there is to that, but I just remember that moment when that individual had said that. And that's something that I've always been passionate about, is that how could we do a better job? And I know that's something you do such a great job on. I think it's something that we strive for at our office all the time. But across healthcare as a whole, that is not something I think that's done very well. And I think there's just so many misconceptions and things like that. I wanted to go through and just talk a little bit more like we talked earlier on that topic of, in medicine, we are very reactionary. That's just how the system's been set up.
It is.
Way before us, it was set up as this reactionary system. There's a billing code there that is already into a chronic disease typically. Reimbursement is based off of that typically. And a lot of times when it's right to intervene, realistically, if we were just being real about people we care about, it would be really early on. Don't let this turn into something, because when you sit in shoes like yourself, or in our shoes, where we see these cases where it's like, man, what has their last 5 to 10 years been like? You know, those types of moments where this clearly was not going where we'd love for it to go. But now you do such a great job of saying, how now can we turn this around? What steps is that going to take to get you back living the life that you need to live? And that's something that we've always been so impressed with, and have been very honored to work with those cases and see some massive transformations and see them get to something we value very highly, is them choosing on their own by the end of it to now get that gym membership at like a Workout Anytime in Hendersonville or something like that, and say, now I'm going to keep up this hard work that I've been doing, lifting these heavy weights, picking up, cases with what they came in with this preconceived notion that they had this chronic problem because they saw something on x-ray that their primary told them 20 years ago, that really that the story goes it's a little bit different than that. What goes through your head when we talk about topics like this?
Yeah. So, I think first of all, a lot of my patients, they either have jobs that contribute to their pain. For instance, I have a lot of, construction workers, hairdressers, et cetera, people who are up on their feet for long periods of time. Ideally, that's not necessarily the best thing for your back to be on hard surfaces for long periods of time. But, I understand that's their profession, and, we all have to earn a living. But I think it's important when you first start having pain to not let it develop into chronic pain. And that's mostly what I see is chronic pain, because usually when patients end up, in my clinic, they're already in chronic pain, that they've had pain for, several years usually. I think it would be much more beneficial if, when they're more in that acute pain state, earlier on, if they could get in with someone like you, who's going to work with them, strengthen, certain muscles, help prevent it from further deteriorating, help prevent it from turning from acute into chronic pain. I think, getting ahead of it from the beginning is key.
Yeah. When you talk chronic, that term gets thrown around a lot, and one of our listeners had asked about that. How would you define chronic pain versus someone that feels that they just, have some discomfort, like, I feel some neck tightness every now and then?
Right. Yeah. Good question. So most medical professionals would describe chronic pain as pain persisting past the usual normal amount of the normal length of time that an injury should, hurt you or bother you. And so we look at kind of a 3 to 6 month range. So if it's over 6 months, then it's chronic pain. If it's less than 3 months, it's acute. And so that's kind of how we determine that.
Yeah. And if a case comes in, one that jumps in my mind, that cases that we hear about all the time, is that individual that, it seemed like it wasn't that big of a deal. They were doing something in the yard, did some work, had a bout of pain for the first time, waited it out, because waiting on their pain is a very cultural thing, that they've had some discomfort for a while. They're just like, I'll be fine. Keep pushing through. And at some point, it just kept going and going. And then at some point, they finally sought care. They said, hey, maybe here's a couple options, wait it out, et cetera. And then at some point, they've had enough. And at that point, if they didn't get the advice, just like you recommended, that they get somewhere where there's a conservative specialist in that first realm to really help them, and they just wait it out. Sometimes they create maybe new movement habits, or they get an emotional connection to it and avoid certain movements that they really needed to get back to what they were doing. And then all of a sudden, they've gotten in this situation where to them, it's very overwhelming. In a case like that, that they show up into your office, what's a typical workup look like?
Yeah. So, we do, the standard history exam, history physical exam. We're going to take a detailed history, social history, family history, past surgical and medical history. If we're talking about back pain, some key things I'm personally going to know is, is it axial or radicular? Meaning, does the pain just stay in your back or does it shoot down your legs? Because that's going to clue me in to what's possibly causing your pain. I'm going to want to know what makes it better, what makes it worse. I'm going to want to know, have you had surgery before? Have you had injections before? Have you had chiropractic or physical therapy before? What medications are you taking? And then, physical exam, I'm going to do a detailed exam of the full body and specialize on the back and on the neurologic system, the musculoskeletal and neurologic system. And then I'm going to look at any pertinent imaging, so x-rays, MRIs, CAT scans, whatever it may be. And I'm going to come up with a diagnosis based on all of that. I think sometimes some providers may jump the gun and just look at an x-ray or an MRI and say, oh, there's a bulging disc, that's your problem, without really examining the patient, without really taking a thorough history. And a lot of times that's not even the problem. Because as we know, there's been large studies that have been done on discogenic degenerative disc disease, where 1/3 of the population has degenerative discs, and the majority of them have no pain. So we know that just because you have bulging discs, that doesn't necessarily mean you have pain coming from discs.
I think that's important.
Keying the whole picture in, that's history exam and image findings all together to decide what.
I want to rehash that for our listeners. Wanted to give a shout out to Drew Davis, Alan Bickmer, and thanks Leslie for sharing. A couple things that are really important that listeners may have just heard and not really understand if they're not in the medical world, if they're not in the healthcare world and understand some of this. What Dr. Wilson just went through was, I'm going to step back and I'm going to look at every single piece, and then that's going to help lead to my decision, as opposed to a way that has happened, unfortunately, too often, where imaging has been the go-to method to diagnose everything and then treat based off of a scan. And I think the reason that's really important is exactly like he said, is that we've learned so much has changed in the last, even just 10 years, but the last 20 years, and how much that we've learned and understand is that, you can get that scan, but there's certain times that's way more valuable than others. And there's a cultural response though, because they are intriguing, right? I can't think of anybody ever in life that has had an x-ray taken of themselves and weren't like, wow, right? The first time they see an x-ray, it's a wow moment. I don't care who you are, it's pretty impressive. However, it takes a really skilled clinician to step back and then say, okay, what is the value here though? And so for us, what's really important is on those images, our physical exam and history is so important. And I think that what is so great about what you just went through is that is what a great clinician does. And what the big difference in our exams that you're going to do versus that our clinic's going to do is really the timeline of the patient that we're seeing, right? We're meeting them at just different parts on that continuum, but we're using the same science to do a very thorough exam and look at all of that put together. And that helps us as clinicians come together and figure out what the heck's going on. And the image does not tell all the story. And only in a couple times does it really tell you. If it tells you, hey, we need to inject here, or hey, we need to surgically do a procedure here, yeah, it's going to help that in emergency medicine really, really well. But in these persistent cases, just like he said, it's actually not as much the imaging as you think. And I think that's an important message to really understand, because so many people will think, oh, well, my father had an MRI. That must mean I need one now that I've had a little bit of back pain. But then the exam reveals that that's not going to change the course of care because of X, Y, and Z reasons. And I think that's where it's important that you have to have that great relationship with your clinician and your provider. And I think that's what's really important. I think for the listener too, the topic that I would like to go into next is to take that step further and say, we have been so excited to be able to work with you over time, because just like in every profession, but healthcare is such a highlight in this country. people are very in tune with medicine or healthcare. There's enough TV shows. It's intriguing because of that when there are some bad apples in, say, the chiropractic world or the therapy world or the pain management world, right. It really does. I sit on my state board. We see those cases and they send a beacon, right?
Yeah.
And the hard part is that's like most any profession, those minority, cases not doing the right thing need to be handled. But the ones that are doing a really great job have an unbelievable skill set that can really help the community and help someone in pain turn their life around in a really great way, just like yourself. And I think that's something that really needs to be highlighted, is that depending on the provider, when you have a really good medical team, and in Hendersonville, we have quite a bit of really good providers. If you're with the right one and they have that good network, everybody's expertise can really shine. And I think that's something really important.
Absolutely. I agree 100%. Absolutely.
Let's talk a little bit about that continuum a little more. We see a lot of cases where if you can intervene at the right time, you can get them on a train of thought and get them back motivated to take control of their health again. Something we see frequently is that now that I've been in practice for 11 years, I've actually had the fortune and then the unfortunate side of seeing some cases that I saw over a decade ago and then now where they're at now. And I think there's a lot to be said about that. There are some that I've seen that have been doing unbelievable. Some that were barely doing walking that are now running thousands of miles a year. We see some that are even older that were on a lot of medication that are now down, where they've done a really great job. They've got their diabetes under control, and now they're on very minimal to no medication, getting their physical regularly and doing a really great job. I want to talk about that split, that time that happens when a patient comes in. And the reason I think you're one of the best experts to talk about this is because you get to see this all the time, way more often even than we get to see it, where they're already in that moment, meaning they're already at that point where, and a lot of listeners, the age demographic that's watching, a lot of their loved ones are ones that are right on the brink of this or in that moment where they're having this persistent pain and they're seeing that shift in their lives, that it's maybe not going the way they want it to go. But if they really had their skilled clinician with them handling it the right way, they know that they could be their mom or dad again. Like they could be back doing how that they should. So I want you to talk a little bit about when those cases come in and you've seen some of those. What's that been like? What's been maybe some catalyst or just some advice to those that, when they're seeing that and they come in, they get with a good clinician, and now we get to see that shift go the right direction, what that's like?
Yeah. So I've had, I can't even tell you how many patients I've had who have come in with chronic pain, who've had, back pain, neck pain, knee pain, whatever it is. But they've had pain for 10, 20 years, and no one's accurately diagnosed it. No one's done a thorough workup, and we do that, and we diagnose the pain. I'll give you an example. A lot of people that I see have arthritis in their spine, and they have pain coming from that arthritis in their spine. And they've never had a procedure for it. And so, after a thorough history exam and imaging, everything correlates to suggest that that's where the pain comes from. I do some injections in their back, and I've seen people who couldn't go out and garden anymore, and now after getting the procedure done, all of their pain is better. And not only that, but they're able to wean off of their medication. They're able to get back in the garden. They're able to go back out on the golf course. I have patients who come back in tears thanking us, for helping them. And I don't know how many times they've said, "I wish I would have known about this earlier. I wish I would have known about this sooner." Yeah. And then what's equally important is after we do that, after we alleviate their pain, the second part to the second piece of that story is I like to get them in with someone like yourself who can show them, walk through a good exercise program for them, core strengthening and all the exercises and stretches and so forth that you show them, because that is equally as important in the long-term health for them, because I want to alleviate the pain, but not just for the sake of alleviating your pain, but also to help improve your function and your quality of life. And that's a piece that you can help them with as well, is get them more functional, strengthen them. If they're only able to walk around the block, they're only able to walk to the mailbox. Well, now they can walk around the block. Now they can walk, farther distances. They can, do the things that they want to do. Yeah. And so that's been a really rewarding part of my practice is helping people like that.
I think that's great. I want to highlight that a little bit, because we talked about earlier in this show that there's good evidence that there's a lot of cases where they may have arthritis, but it's actually, that's not what's causing or driving their pain. But then there are cases where that is what's giving them the sensitivity and the pain. And there are options and procedures that you have, and you alluded to a procedure that is something that y'all do frequently that opens up what I say a big window of time that allows us to do some really great things. Can you talk about the procedure that typically happens with individuals that have that we've done the thorough exam and realized in this case, the spine pain is actually their real driver. It's not just purely weakness, but they've gotten to the point where the spine pain is so significant that they need help opening up a window of time so that they can now get the strength back to take their life and control their life back. What is that called, and what does that look like?
Yeah, so the procedure I was alluding to is a two-part procedure. The first part is a test. The medical term for it is medial branch blocks. But essentially what that means is I would lay a patient down the table, and we would have a sterile environment, and you'd be under an x-ray machine, and I would numb the back, and then I would use the x-ray to help guide a very thin needle to the outside of the spine, to the area where that medial branch nerve sits. And I would place some numbing medication on top of that to numb the nerves that go to the arthritic joints in their spine. And that's a test. What I want to know by that is if I temporarily block the nerves that go to those joints in your back, does that relieve your pain? And if so, if that does relieve your pain, that confirms that, hey, your pain is coming from those joints. It's not coming from your disc. It's not coming from your muscles. We've confirmed that your pain is coming from those joints. And then the second part is how we treat it. It's called radiofrequency ablation, which is simply like a nerve burning procedure. Now, I know that may sound scary to some people, but it's actually not. So the way we do that is very similar to the test. We numb those nerves with a very small needle, and then after the nerve is numb, then we place a very small wire inside that needle. We heat it up and zap those nerves. But of course, the patient is completely numb before we do that, so it's not like they feel that part of the procedure. It's a very minimally invasive procedure, and it relieves pain on average for about 6 to 9 months duration. And because of that, those particular patients are able to get out and do things that they haven't been able to do in years. And that's just one example. Of course, we do many different types of spinal injections, other stuff to help control.
We had a couple questions come in, but I just want to summarize that. So in that situation, let me know if I have this right. Individual comes in, they've already been through some type of care in the past, realize that this has been going on way too long. You do a thorough exam. You look at every aspect. You find out that it looks like this is coming from the actual spine. So that's the theory. You're testing that theory by saying, all right, we're going to look under live motion x-ray. We're going to go right to the nerves that have you feel that part of the low back. You're going to then numb those and then retest and say, all right, does it hurt now? Yes or no? And if they say, no, I actually don't feel it anymore, then now you can perform a procedure that opens up a window of time for them to get back to doing movements and such that can really get to the cure and the source of keeping that pain away, which is getting stronger, getting moving, finding alternative ways instead of just overusing or compressing at the low back. Maybe that's the habit that's happening for that individual. They just, for some reason, they don't have enough range of motion around it or enough strength. So what they end up doing is just finding the same way to cause the same irritation to that same part of the spine. But now they have an opened up window of time where they can try to regain the strength necessary to maybe not rely on those joints as significantly. Does that sound somewhat close?
Absolutely. And that's why it's good to get in with someone like yourself after we alleviate the pain, so they can strengthen the right muscles and take some pressure off of those joints. Yeah,
that's awesome. Someone had asked, a suggestion was, are there alternatives to using to an ablation? Are there other options that you can use from a conservative? So there are other options. So if someone comes to you for a thorough evaluation, goes to a pain management rehabilitation doc and says, "Hey, I want to work up." So that's just one of many different options that you have, but it's one that has some pretty good efficacy in cases that apply and qualify for it, to give them an opportunity to turn that around.
That's right. That's absolutely right. So if we were to take that specific example of arthritis pain in the back, so the ablation would be one route. Another route could be we could just simply do an injection under live motion X-ray, where I go inside the joint with a needle and just put a little bit of steroid in there. So we could do a steroid injection as well. There's some reasons why that's not the best option, but it can buy you some time. It usually only helps maybe 2 or 3 months. It doesn't provide as long-lasting relief, and if you do it too often, it can lead to actually more arthritic changes if you're putting a needle inside that particular joint. It's fine to do it once in a while, but it's not a good long-term plan. Some other options would be medication. So anti-inflammatory medication, like over-the-counter ibuprofen, Aleve, Tylenol. Tylenol is not an anti-inflammatory, but it's a pain-relieving medication. So medications like this could be helpful. Of course, referring to someone like yourself for therapy, that's another option. So yes, there are many different options.
When we think about cases where you'd said, an injection is an option sometimes for them, what is a case where that has been very successful, where you said, under live motion X-ray right now for this individual, we talked to them and they said, "Hey, here's your options," and you said, "This is something that could be right for me. I feel good about this." What's a case like that? That's successful? When's that the option over an ablation for someone?
When's that an option to do an ablation?
Let me change that verbiage. When is it the choice that they would go with versus doing the ablation? So you're in that appointment, did the exam, and you said, "Hey,
why
look,
would you want to avoid doing the ablation?" Yeah. So I think, honestly, if someone hasn't tried physical therapy yet, chiropractic therapy yet, if someone hasn't tried oral anti-inflammatories yet, it's probably best to go ahead and start with a more conservative approach, and that is my approach. We don't jump to injections, but remember, by the time patients get to me, typically they've been in chronic pain for many years. They've already had medications. They've already had physical therapy. They've already had, maybe acupuncture or trigger point injections by their primary care doctor, or they've already had, and so they're looking for something additional. And so at that point, we would do the injection. But to answer your question. Also, if they feel like their pain is not that bad, it's just maybe just a little annoying, but it's not bad enough to where I want to have an injection in my back, then maybe let's look at some other alternatives.
Yeah, I think that's really good. So I think the moral of the story, there's an opportunity for certain individuals in pain that really need to make a change, that there's a place where there's a procedure they can do that's not surgery, and
Right.
still be able to get back to the things that they love and open that window of time to get strong with the right provider. And that can go really, really well. And I just think we've just seen that so many times. I can't wait to have you on again because at some point I really want to talk about the opioid discussion, because the number of patients that we've got to work together to get off of those medications, because there was a time where that was not the vibe around town, is that individuals
Right.
are getting off those medications they've been on for a very long time. And that's something that we got into really well. And I would love that discussion, because I think that's touched just about everybody in our community at this point, someone in their family they know that has had an issue. And I think that y'all have just done such great work and be able to help so many get their family members back with that. So that's something that I've always been proud of. To close out the episode, one thing I did want to talk about, we wanted to introduce our new segment, Kids Corner. And I wanted to, I think this is something really, really important to me. So you've got a Kids Corner story. I'm going to have a Kids Corner story, but I wanted to jump in one real briefly about your daughter, Ava, real quick. And this is really funny because she does sell Girl Scout cookies. This is part of her life. So she's very good at doing, by the way, unbelievably good at doing. But something that's really funny, it seems like, I don't know what time of year it is, but every single time it's time to sell Girl Scout cookies is right when I'm having a conversation with my wife and I'm saying, honey, no more sugar. We're not doing this crap anymore. We're turning our life around, right? Every single time. And then you know what happens? It's like right about that time, here comes Ava rolling in the clinic and just says, would anybody like Girl Scout cookies? And I'm like, we will take all of them.
You can't say no to her face.
You literally cannot say no to Ava. The girl is just, I'm telling you, if we can do 20% as good of a job as raising Amlin and Ellie and to turn out how Ava has at her age, then my God, we've just got it all figured out. I mean, that girl is just unbelievable. I just tell you, I just know the second she comes in, everyone in the office is like, looks like I'm getting 3 boxes. And it's so funny because what happens then? You wait for the cookies. Cookies finally come in and you're like, all right, I'm still turning around. And you're like, dadgummit, here they are. And then what do? It's like, I'm eating 10 of these. I'm like, I'm doing this for Ava. So you just pound 10 cookies in one setting. It's such a mistake, but she gets me every dadgum time. But man, I want you to open up the Kids Corner.
Yeah, and no one can eat just one cookie.
Never, man.
Yeah, so I actually have a short, funny story for each of my kids. I don't know how much time we have, but
we got 5 minutes. We got time. And right then.
So one about Ava, since we're talking about her, is she came to me. She was about 10 years old. She came to me at 9:00 at night. I was in bed, and she said, or so I thought she said, "Daddy, will you come upstairs and play with me?" And I said, "Ava, it's 9:00 at night. No, I'm not going to come up and play with you. Go to bed." And she went upstairs crying. She's in her room crying. And a few minutes later, my wife comes down and says, "Brad, do you realize your daughter is upstairs crying her eyes out because her dad won't go upstairs and pray with her?"
Oh, dang. Oh,
and I ran upstairs. I ran upstairs. "Ava, yes, I'll pray with you. I thought you said play. Daddy, why won't you pray with me?"
Oh my gosh, that just burns so deep. I mean, that's just twists the knife so dadgum hard. We had a funny thing happen the other day. So we didn't get to do our family vacation this year because it was my wife's birthday is right in the middle of all the sickness going around. So they canceled our vacation. And so we decided, we'll do just whatever we can. We'll just make we'll get a sandbox for our girls. We need some way for them to make it through this time because their preschool was closed. And we were like, we'll do this awesome sandbox. So we buy the sandbox. It's 2.5 foot by 2.5 foot, but online, it looked like 12 kids could stand in this thing. We just missed that it was 2.5 foot by 2.5 foot. So we get this thing and we're putting it together for like 2.5 hours. We finally get it done and we're like, this is it. So we get all this sand. We're doing this great job. It's hundreds of pounds of sand. We still get I can't remember. It was like 500 pounds of sand. We fill this thing up. We have a little extra, and we're like, God, I guess it's going to be the best it's going to be. Our daughter gets in within just a few minutes. She sits on it, and the design is so bad that the thing lifts up and the sand just starts to pour out. And we realize we wasted $200 on the jankiest sandbox ever. So we're like, oh, this is miserable. So we're like, to heck with it. Well, the girls keep playing with it. And we go out back. We're hanging out for a second, and they have taken all of the sand and spread it all over our patio. They took all of it, and it's thick. It's all over my grill. It's all over everything. And we're like, what the heck is happening? And our daughter, Evelyn, she's like, Daddy, we made you a beach. And it's this like, you've got to be kidding me. Like, God, your intent is amazing, but this is miserable. This is miserable.
Gosh. Man, that's funny. Yeah, my youngest Luke, when he was about 2 or 3 years old, we were potty training him, and he had an accident, and my wife goes to him, Luke, why did you poop in your pants? Because I farted and poop came out. Kids say the craziest thing.
Yeah, it's amazing. That's one of the most fun things, is they just genuinely are honest and don't even care about a reaction. There's no filter. It just is what it is. Brother, one more cheers to charity for you tonight. Thank you so much for coming. I appreciate you so much. Great show. Can't wait to have you on again. There's so much more to talk about. A lot of comments coming in, a lot of private messages. Can't wait to get into those other and harder topics. Thank you so much for everything, my man, and we'll have you on again soon.
Thank you for having me, Dr. Jason.
Thanks, man.
Bye, bud.